Hello everyone, and welcome once again to another video on mental health during pandemic. So today, this time, this video is especially for our children, how you can help your child to better cope with this situation. And I'm quickly going to mention few points which you can keep in mind when you are helping your child and when they are actually suffering from symptoms like symptoms of anxiety and depression. And first of all, you have to keep in mind that yes, even a child can have symptoms of anxiety and depressions and stress. Though maybe their expression of these symptoms differs a little bit as compared to adults, as compared to us. But so you have to look for their signs, look for the exact signs and symptoms of their anxiety and stress. So first of all, I'm going to just talk about the signs and symptoms briefly. So usually a child shows their symptoms with their shows physical symptoms when they face anxiety and depression. For example, there can be a marked difference or a marked change in their appetite, in their style of in their pattern of sleep. So they may be sleep excessively, or they have a reduction in their sleep, or marked reduction in their sleep. They may dream frequently, have nightmares frequently. Or also they can have a reduced appetite, or an increased appetite, excessive appetite as well. Also, they may show some signs of irritation. They may get angry very easily. May get very stubborn suddenly. So these are the signs. These are a few signs which you may encounter, which you may look for in your child. So first of all, you have to remember that when a child expresses their signs of anxiety or their concern, especially during this pandemic situation, don't discourage them, or don't ignore them, or don't disregard their anxiety. We tend to do that very often. I have seen parents saying that he or she is a child, he is just a child, how can he can have anxiety and depression. That is actually wrong. A child, no matter how small, can have symptoms of anxiety and depression. So you have to always take them seriously and take their concerns seriously. So have a very healthy discussion with them, have a very detailed discussion with them. Ask them what they already know about this COVID-19 outbreak. And if you think that they have some wrong information, try to address them, and also give them the right information in an age appropriate manner. Also, keep yourself calm. Remember that child can sense anxiety in their parents, and actually if you are anxious, and if you are anxious in front of your child, that can be transmitted to them, and they get even more anxious, and they get even more fearful, because they think that you are the one who can protect them. And if you are anxious yourself, and if you are afraid yourself, then how can you possibly protect them? So that is how they think about their parent. So try not to be too anxious in front of them. Definitely try to be as honest as possible. Whenever you are communicating any information, try to be honest, try to be truthful, try to be very clear, and give them short information. Don't give them too much information together. Also, control their social media exposure or media exposure altogether, because there are too much information we know out there, and most of the time they don't understand those information, and they may misinterpret them. So try to grab a control of the information that they get. Also, when whatever sources that they are exposed to, so make sure that the sources are authentic, and also make sure that the information that they are getting, they have the space to discuss them with you, so that you can have a discussion on that topic, and you can clear it out. You can give the proper or right interpretation. Sometimes it is possible that you also don't know the news that they are getting also, or you also don't know the particular information that you are getting. So don't lie to them, be honest and tell them that you don't know, and maybe you two of you can sit together and read about that piece of information. And if you think that they are actually getting very anxious by receiving too many information, try to avoid giving them too much of information together. Definitely give them the appropriate information that are required, to help them gain control. So another point I would like to say is help them gain control over their action. So when they know they can actually control themselves, they can actually prevent themselves from getting the virus, they will feel better, and their anxiety will be reduced. So discuss with them the importance of hand washing, importance of maintaining personal hygiene. Also, you can in this context you can discuss with them the importance of social distancing as well as kindness, how they can look for others, how they can take care of themselves as well as others, their family members and their friends, how they can take care of their neighbors also. So it is a good time to teach them compassion as well. So help them get connected to their friends, to their extended family over phone and over social media as much as possible. Also, another point is, don't push them too much to be productive at this moment. Definitely encourage them to pursue their hobbies, like ask them to or encourage them to maybe singing, painting, dancing, drawing, whatever they can or whatever they want to. But don't push them too much, because it is very natural for them not to be productive at this point of time, because they are already stressed, they don't know what is happening, and also they don't know how to react, because this is completely new to us. So definitely this is very new to them, and maybe they are not even understanding, they are not even understanding the situation or interpreting the situation clearly. So it is very natural for them to be less productive at this time. So give them proper space, and just give them time to adapt to this new normality. So they will definitely come to you if they need help. So be present, assure them that whenever they want you will be there, but don't ask too much questions. If you think that your child is in stress, don't ask too much questions, give them that space as well. And but make sure that they have the assurance that whenever they need, they can come and talk to you. So also another thing, be a role model. So remember that child always learns by modeling. So whenever try to maintain a healthy routine, try to exercise, try to pursue, try to do whatever activities that you like, so that your child actually follows you. Also, if you think that your child needs more help, if you think that he is not being able to cope with this, and you can definitely seek help from a professional. You can talk to your friends, you can talk to your family. If that doesn't help, then you can seek further help. There are telecounseling which are available right now. You can reach out. You can also contact me. I'm also available. I'm also offering telecounseling. So we are always there. We are in this together, and we will overcome this together for sure. Thank you so much.